Hormone replacement therapy in women's had a bad name since a large trial showed that it caused breast cancer and increased the risk of heart disease. But those were female hormones. But what about the male hormone testosterone? There is evidence that it could be of benefit to women. The research in this area that's having an impact is being done in Melbourne by Professor Sue Davis.
People generally are not aware that testosterone is an important female hormone. Women actually make estrogen in their bodies from testosterone. At any one time, a healthy young girl has more testosterone circulating in her blood than she does estrogen.
What is sexual dysfunction in women? How is it defined?
Female sexual dysfunction can be the loss of desire, low arousal, sexual pain, or inability to have an orgasm. Some women may experience just one of these things, other women may experience all of them. But ultimately, it's really whether or not a woman experiences a satisfactory sense of sexual well-being or not. And only that can be understood by the woman herself.
What are the causes?
Well, there are multiple causes. A woman might have had bad sexual experiences in the past, she may have a bad relationship with her partner, or she might have changes in her general health, such as illness or depression, that impact on her sexual function. There are other factors, for example, change in hormones in the body that occur with age, or changes with menopause that can impact on sexual function in a woman.
What's the evidence that testosterone is related to sexual desire?
It's natural for testosterone to decline with age. However, we know for certain that women who have their ovaries removed, and at that time their testosterone levels drop acutely by about 50%, have a significant reduction in sexual desire and arousal. And if we treat those women with testosterone, there's an improvement in arousal and desire and sexual well-being. Now, across the board, women's hormone levels, testosterone levels, decline with age. So by the time a woman hits about 40, her levels are about half what they were when she was in her 20s. So the question is not what the level of testosterone in the blood is, but whether low testosterone is causing the symptoms. And that can only be determined by really looking at the full picture of any individual. It's not simply do a blood test, give testosterone.
Tell me about the study you did.
We did one particularly large study where we recruited 800 postmenopausal women across multiple countries. And these were women who felt that they had lost sexual desire compared to their younger years and that they would like some treatment to improve it. And women were randomly allocated to either receive a placebo patch, skin patch, a testosterone patch in a small dose, and a testosterone patch in what we call a 300 microgram dose of testosterone. And these women wore these patches for 12 months, not knowing what treatment they were on. And by the end of the study, we found that the women treated with the 300 microgram testosterone dose had significantly greater desire, arousal, and other parameters of sexual well-being compared to the women on placebo. But more importantly, women were recording every sexual event, and they reported each event as whether it was satisfactory to them or not. And the women treated with the testosterone patch had significantly more satisfactory sexual events than the women treated with placebo.
And drugs can cause sexual dysfunction as well.
Well, certainly there are classes of drugs that impact on sexual dysfunction in both men and women. And the most known compounds are what we call selective serotonin uptake inhibitors, or SSRIs. Now, these are used to treat depression. And as a consequence of SSRI therapies, many men experience erectile dysfunction. And in women, they commonly cause loss of arousal or inability to achieve an orgasm.
How do you know it's not the depression doing it?
Well, what is often seen is sexual dysfunction with depression, so classically loss of libido. The woman goes on her antidepressant therapy, she starts to feel better, but then she recognises that she has no libido, or has libido but can't actually get sexually aroused or have an orgasm. So when this emerges really as a major problem is that when the woman is actually starting to get better from her depression. And the problem then is, if a woman feels that this is really impacting on her quality of life and her relationship and starting to create tension in her relationship, a woman will then stop the treatment of her antidepressant, which she actually needs. So what our group is doing now is a specific study looking at women who have experienced loss of libido or loss of arousal in association with treatment with an antidepressant, and we're randomly treating them with either testosterone or placebo therapy to see if testosterone will help these women.
And safety? Some people say that testosterone is related to increased risk of heart disease or some cancers.
The evidence as we have it today suggests it's safe. There is some very limited data looking at breast cancer not showing an increase in risk. And from a cardiovascular safety point of view, most of the data is from what we call observational or population studies. And again, none of these studies suggest any significant increase in risk of cardiovascular disease.